We at the Howard Center want to recognize the commitment that our primary care partners make to suicide-safe care and suicide prevention. We also want to recognize that there always seem to be more screenings coming down the pipeline for you folks to administer. When we talk a common language, or when we use common tools and we're able to stratify risk, as Mark said, we believe that patients are going to get the care they need at the point of care more efficiently and more effectively. And we also believe that there'll be decreased ER utilization, so that if somebody's screening at a lower risk, there are options to handle and support that person in the primary care setting in collaboration either with your designated agency or private mental health providers.